Emma and I'm a physiotherapist at the Joan Kirner Women's and Children's Hospital at Western Health. This video will focus on strategies that you can use to help you recover during the first 6 weeks after delivery. In particular, we will focus on rest, ice and compression wear. In the first 6 weeks after delivery, your body needs care to recover from both pregnancy and childbirth, regardless of whether you have had a vaginal birth or a caesarean section. Everyone will have a different recovery journey, and the early weeks after birth are an important time for healing. You might have heard of the Rice recovery principles when talking about sporting injuries. These principles can be also used to assist with soft tissue healing after childbirth. This includes either vaginal tearing, episiotomy, or C-section scar. Here's how to apply the Rice principles after your delivery. R stands for rest. We recommend you spend at least 1 to 2 hours each day lying down to give your abdominal and pelvic floor muscles some anti-gravity time to rest and restore. Also, when getting out of the bed, we suggest rolling to your side and pushing up with your arms to reduce pressure on the abdominals and pelvic floor muscles. I stands for ice. Ice has good anti-inflammatory effect and can be used on the perineum straight after birth. The perineum is the area between the vagina and the anus. After vaginal birth, we suggest placing an ice pack inside your pad and applying to the perineum for 15 to 20 minutes every 2 to 3 hours. Ice should be continued for a minimum of 72 hours, but recommended for as long as you have discomfort. Remember to have a layer in between your skin and the ice pack to ensure you do not burn your skin. Here is a demonstration of how to place an ice pack inside your pad. C stands for compression. Support around the lower abdominals and perineum can not only feel great, but may also help to limit strain through these areas in the first few weeks after birth. There are a range of postpartum compression garments on the market, such as Tubigrip, recovery shorts, or shapewear, which are available from any department store. When in use, any support garment should feel supportive and comfortable. It shouldn't feel too tight or restrictive. These can be used safely from the first few days after delivery, regardless of your delivery type. For those who have had a caesarean, you may find it useful to cover your wound with your hand when pulling the shapewear up over your abdomen. Here is an example of shapewear. E stands for exercise. The pelvic floor are an extremely important muscle group which requires some attention to recover after pregnancy and birth. Pelvic floor exercises will be discussed in detail in the video titled Pelvic Floor Exercises. Thanks for listening. If you have any questions regarding the information discussed in this video, please contact the Women's Physiotherapy Department on 8345 1727.